Hello, hello, and good morning, everyone. We're going to just wait a few moments as the Zoom room populates here. We're very excited. Welcome to the Age My Way Federal and State Advocacy Update webinar here with Central Carolina Area Agency on Aging. So as people come on in the room, we're just going to take a few moments to talk about some of the Zoom webinar features. So a few little housekeeping announcements here. In the Zoom webinar format, you are automatically muted. You cannot see other participants. The only people you will see are the speakers and the host today. But I do want to call your attention to the chat box. We do want to hear from you, and we're very interested in your questions. So please take your questions to the chat box, and we will be addressing those questions at the end of the presentation. You'll also notice that today's presentation is being recorded, and we will make that available after today. It's going to be on the Central Carolina Aging website. And that being said, I'm going to turn things over to Linda Miller, the director of the Central Carolina Area Agency on Aging, who's going to MC the presentation today. Linda?
Thank you, Katie. Well, thank you all for being here. We're really excited about this webinar. We did this about a year and a half ago, something very similar, and got great response. So everybody really likes keeping in touch with the legislative issues. We have a really active group in around the Central Carolina region that really want to know what can they do to advocate for older adults. So thank you all for being here and for your continued support. These webinars have been a much bigger success than we ever dreamed possible. Our staff have all gotten into the mix. Thank Katie today for running things and making sure they go smoothly, but we have about 4 or 5 staff that have just helped, and they dive right in whenever it's needed, and we'd like to thank them. So we're celebrating May as Older Americans Month, and this is a historically, the Older Americans Month has been a time to acknowledge older adults and their contributions to our country. And in particular, we always make an effort to recognize those older adults who have defended our country or are veterans. Every president since John F. Kennedy has issued a formal proclamation during or naturally before the month of May, asking that the entire nation pay tribute in some way to our older adults in our communities. Older Americans Month is celebrated across the country through ceremonies, events, fairs, all sorts of things, all sorts of creativity. Our senior centers, our congregate sites, everybody gets into the act and all sorts of activities. So I know that we get excited each year waiting for the theme. They do a great job with the theme, and this year it's Age My Way, and we really thought that it really tied into seeing the big picture, that aging your way ties into what can we do legislatively to make that quality of life and that ability to age in the community in the setting that you want to in your own home, if that's what you want, as much of a reality as possible. So thanks, Katie. All right, so we want to thank both of our distinguished speakers today. We're really excited about this. And if you bear with me, we have 2 speakers today. I'm going to introduce both so that we can flow smoothly from one speaker to another and make sure that we have enough time to get your questions and your comments in. So Bob Blancato, then Bob will be our first speaker. Uh, Bob is the president of Matz, Blancato and Associates. He is also the coordinator of the bipartisan member, 3,000 member Elder Justice Coalition, and the executive director of NANASP, which stands for the National Association of Nutrition and Aging Services Programs. And he's also the national coordinator of the Defeat Malnutrition Today Coalition. Bob's long been recognized as a national advocate with policy expertise on behalf of older adults for several years, and he's frequently called upon to testify before legislators on issues such as elder justice, malnutrition, and nutrition. And on a personal note, Bob is a very good friend, and I've probably known Bob for 15 years, so you're going to love and enjoy Bob's talk, I promise. And Heather Burkhardt, who's on screen for right now, Heather's going to speak second. Heather has over 25 years of experience working on behalf of older adults, spanning both the nonprofit and state government. Heather served for 18 years at the North Carolina Division of Aging and Adult Services, and during her tenure, she functioned in a variety of programmatic and administrative roles for which she was responsible for strategic and program evaluations, system evaluation, and policy analysis. She served as the assistant director for 2 years from 2015 to 2017, and Heather draws greatly from her nonprofit and direct care experience at both the Pitt County Council on Aging and Resources for Seniors. Heather earned her bachelor's and a master's degree in social work and her certificate in gerontology from ECU. So, and on a personal note, I've known Heather for longer than I care to remember, and Heather is now with the North Carolina Coalition on Aging, and she's doing just a great job, and we're excited to hear her give the North Carolina perspective. So I'm going to turn it on over to Bob. Bob, thanks for being here.
Linda, thank you for a very kind introduction. But if we go to the first slide, I'll do what's called the introduction, and I may or may not follow the slide completely, because the first thing I'm gonna do is thank Linda, because not only for her leadership at Central Carolina, but this is a woman who's had many roles in many settings, state, local, national. She's the chair of our board of the NANASP. She has been put many years in leadership roles at N4A, SE4A. She just likes to give her time and her talent to a lot of groups and makes a huge difference in all of them. And so it's great to be back. It's great to be back in Central Carolina Area Agency on Aging. I feel like I'm a friend. I've been there a couple times in person and virtually. I know the great work you do the day in and day out, especially in these pandemic times. And I was very proud to see you get your award at the American Society on Aging this year. I was in the audience. Congratulations on that. And as Linda pointed out, happy Older Americans Month. Now I'm actually one of those people who you're celebrating for, because I have reached that point. So I remember I was thinking about them, older Americans, before. Now I'm one of them. And Heather, of course, is great to be on a program with. She's a great leader in your state. And, I guess it seems that more and more people want to age their way, age my way in your state, since you now rank 9th in total population of people over 65 in the United States. So let's go to the next slide. We'll talk about what I'm going to hope to cover today, wearing various different topics and hats. We're going to talk about funding at the federal level for both the current fiscal year and next fiscal year. We're going to talk about an exciting new announcement made just last week for calling a White House conference on hunger, nutrition, and health. We're going to talk about a new request for information that was put out by the Administration for Community Living about rules and regulations for the Older Americans Act of 2020. Update you on a few developments in the malnutrition space, and update you a little bit on some activities in elder justice. So let's go to the next slide, talk about funding in 3 acts. Okay, and this is not news to a lot of you who deal with federal funding, but we have these 3 dimensions, if you will. The pandemic funding, that period of time between March 20 and March 2021. Fiscal year 22 funding from October 1st, the current fiscal year that you're in, that runs through September 30th of this year. And then fiscal year 23 funding that begins on October 1st and ends next September 30th. So next slide. And as we all know, and you know specifically well here, pandemic funding has added significant new funding and flexibilities in older adult programs. The Older Americans Act alone, receiving $2.4 billion in emergency funding from the 4 different bills that were passed. with the nutrition program itself getting $1.6 billion. And, you know, in addition to that, SNAP program, the food stamp program, getting an additional $27.5 billion and raising the minimum benefit. The commodity supplemental food program, which is an all seniors program, getting a $50 million. And the various block grant programs, community development block grant, community services block grant, getting modest increases. And we also have the flexibilities that were built into the pandemic funding, including unlimited transfer authority, initially just between home delivered and congregate meals, but ultimately throughout the entire Title III of the Older Americans Act. Waiving the 1/3 RDA nutrition requirement for meals provided in the Older Americans Act. That was done out of necessity because it was clear, as you'll hear in my next slide, it was clear that the conversion of this program to an all home delivered meal program was going to lead to a huge increase in the need for shelf stable and frozen meals. And there were only a certain number of entities able to provide that. And so, you know, once you relieved that 1/3 RDA, it allowed the business world to open up a little bit wider and bring more people into our space who could provide these meals when they were needed. And let's think about the Older Americans Act Nutrition Program, how it had to pivot during the pandemic. You know, the biggest conversion of this program in its 50-year history that we just celebrated on March 22nd. Before the pandemic, think this out, 2/3 of older adults in the program received their meals in congregate settings. By the end of the first months of the pandemic, more than 90% of these same older adults received homebound meals or grab and go meals. And we had the opportunity, myself and my colleague, Ellie Hollander from Meals on Wheels America, to talk to congressional staff folks who are asking us questions about, you know, as the pandemic began, what's going to happen? What do we envision? So what do you do if you run a membership organization? You reach out to your members and say, give us a picture on the ground. And basically what they were saying was, you know, that senior center, that nutrition program that we were open on Monday, it'll be closed by Friday. So translate that into reality. Let's say you served 100 people in a congregate site on Monday. By Friday, those same 100 people had to be served, but they're going to be served in 100 different locations, like their homes, which then leads to higher costs to operate the program. This is even before inflation took the turn it's taken recently. And you look at the two fastest increases caused by inflation, food costs and gas costs. It's clear to see why Congress responded when they did early in the pandemic stages, and hopefully will continue to respond as we go forward. But good job to Central Ina and all nutrition programs around the country for the work they did in allowing this conversion to happen and keep services flowing seamlessly to older adults. Next slide. But, you know, pandemic support is expiring. It's tied to how long the public health emergency goes. And right now it's looked to be, the initial thinking now is it may end in mid to late July of this year. It all depends on what new variants show up and other elements and other factors. And of course, there's time limits tied to the various pandemic bills when the funds have to be spent. And then you have an additional factor, which has caused complications. In the fourth of the pandemic bills, the American Rescue Plan, they basically forgot to include waiving the match requirement. And that has caused a lot of problems in a lot of different states. It's held up the release of the money that was intended to be out quickly. And I believe, if we go to the next slide, I think it had a factor in, you know, the decisions that were made for funding for the fiscal year under the regular appropriations process. Because the funding that was approved by Congress really only provided modest increases for aging programs. I mean, the largest program increase in the Older Americans Act was $15 million. And it's, you know, that's a small increase for a program with the need that it has. So in my judgment, fiscal year 22 was more of a placeholder awaiting final word on how far the pandemic money went and how much it was still available. And you can see the chart, just to give you the sense of the numbers, and you'll have access to these slides after the webinar. So if we go to the next slide, let's talk about the here and now. Okay, the fiscal year 23 funding that will be in October 1st. The job we have is to avoid the service cliff. Okay, I will tell you work is underway on getting funding bills passed for the new fiscal year, but central to all of our advocacy strategies at the local, the state, and the national level is to avoid the service cliff, meaning for those programs and those services that were maintained or expanded to meet growing demand, having to cut back due to lower funding amounts. When you have that, that's when you hit the cliff. And to avoid this, it's going to be vital to get good, solid reports on how these funds were used. And we are working closely with the entire aging network to get this vital data. So if we go to the next slide, let's take a look at a chart here that will tell you kind of where we are. All right, the final numbers for fiscal year 21. This is outside the pandemic. These are just the regular appropriation numbers that you get from year to year. The final number for fiscal year 22, the one that we're in right now. And the final column is the beginning process for fiscal year 23, the release of the president's budget for the fiscal year. And as you can see, there are increases provided, but in the context of what we are looking at in terms of the realities on the ground, we believe that these numbers are insufficient to meet the needs that we see coming down the road. We're grateful for the increases that were provided. It's easier to work from some increase versus no increase when you're doing advocacy for money, and we're very happy to see the $300 million increase proposed to be provided for nutrition programs, but that's nowhere near enough. Title 3B, that's a good increase, but that's nowhere near enough. And we have to really examine all these numbers and see where we can make improvements and adjustments in them between now and when these bills get passed. So next slide. And, it's interesting because we're at a critical time right now as the work is already underway in both the House and the Senate. And in fact, tomorrow, at this very moment, this very time, at 10 o'clock tomorrow morning, I'm testifying before the House Subcommittee on Labor, Health, and Human Services on a hearing on healthy aging, maximizing the independence, well-being, and health of older adults, appropriately done during Older Americans Month. And if you go to the next slide, what I will be doing tomorrow, in addition to the testimony that I'm giving on elder justice, is I will be repeating our joint NANASP Meals on Wheels America proposal calling for doubling of funding for the nutrition programs and also funding for senior centers, making the tie to elder justice in that congregate nutrition centers and senior centers provide that socialization opportunity, which helps to combat social isolation, which we know can be a key predictor of elder abuse. Now, we know how much more isolation there is now with older adults than there was before the pandemic. We also know that is the people who live alone oftentimes are the most vulnerable for elder abuse, particularly financial abuse, particularly scams. And I'll be presenting data tomorrow in my testimony that is stunning. One number I remember very well is the fact that just on COVID scams alone, COVID-19 scams alone, about testing and about vaccines and so on, older adults lost $100 million in 2020 falling victim to COVID scams. So we need to make the point tomorrow that, healthy aging is great, but for those who are still struggling for it, we've got to take more of an investment in fighting elder abuse, which is not part of healthy aging. So, but advocacy work at all levels we're going to be needed for us to avoid two things when it comes to this next year's funding. We don't want a continuing resolution. We've had that every year pretty much since I can remember. Every year October 1st comes, Congress can't get its work done on time. Then you're stuck with, do you shut the government down or you just continue funding at the current levels? Well, continuing resolution freezes your funding at FY22 levels, which is the chart I just had there. And the other thing we need to avoid is we need to approve the president's budget. We appreciate what he did, but it's not enough. So that's where we're going to be focusing our attention. And if you go to the next slide, I'll give you, I do a thing at the American Society of Aging called the Panel of Pundits. So I'm going to do a little punditry here and say to you, why do I think we'll get a bill passed for funding under fiscal year 23? Number one, earmarks. Okay, now some of you on this webinar may know what those are. earmarks are either a waste of taxpayers' money, or if it comes to your congressional district, it is beautiful economic development. Okay, well, they're back. And every member of Congress has submitted and received funding for earmarks for this current fiscal year. And they will be putting another bunch of requests in for next year. But you can't have them if you do a continuing resolution. So that's reason number one why I think we'll see a bill get passed. And second is the midterm elections. You know, everybody knows they're expected to be close, and they could lead to a flip of either the House or the Senate or both. And since the Democrats are in charge now and the majority, they want to finish, and we want to make sure we can help them so we can get the best possible numbers that we can in our funding. So that's the picture on funding, and I know we'll have some comments on that and questions later. So let's go to the next topic, which is the White House Conference on Hunger, Food, Nutrition, Hunger, and Health. Okay, it's the first of its kind since 1969. Now think about that. Okay, there's probably people on this webinar who weren't even born in 1969, or born after 1969. Think about how the landscape has changed in any one of those categories: food, nutrition, hunger, and health. So it's long overdue, to say the least. The purpose of this conference and its goal is to, quote, develop a roadmap to end hunger and improve nutrition by 2030. Now, for context, having directed the 1995 White House Conference on Aging, I know how these processes work. You always have to set a goal, and you always have to tie it to a certain time period. In the case of White House conferences on aging, was always looking out 10 years. Okay, this one is a little shorter time period because it took a little bit longer for them to pass the bill to authorize this White House conference. But 2030 is an achievable goal, and the way they want to get there is to look. First thing you need to do is look at existing programs, federal government programs and strategies. Are they outdated? Are they fragmented? Can we do better in coordinating what we have before we start looking for new things? And the answer in this space is absolutely. It's taken way too long for us to see the connection between nutrition and health. It's obvious there's a connection between nutrition and health. But the idea is you need to look at what you have and figure out what ways to improve the overall government response. And then you look at new approaches to improving health by eliminating hunger, by reducing chronic disease, and improving access to and consumption of nutritious foods. Let's go back on that thought for a second. There are many of the major chronic diseases that older adults have that could have been prevented had they engaged in better nutritional habits earlier in their life. There's a direct connection between a number of these chronic diseases. And then, of course, the issue of nutritious food. You know, there's an old saying, it is about what you eat. And when it comes to nutrition, our policies at the moment seem to favor, through pricing and other things, poor nutrition versus good nutrition. We need to change the dynamic on that. We need to make foods that are nutritious more accessible and affordable to more people. I guarantee you this will happen as a part of this conference. And as you can see, generating actionable recommendations for the country's next food and nutrition moonshot. So stay tuned. We'll have more on that as we go forward. But next slide, how we'll get to this conference, what they're telling, again, there's very little information out. And I wish I had more to share, but it just came out last week. But they do plan to have 4 virtual regional forums to discuss key topics to be covered at the Washington conference in September. Okay, and there's no date in September yet. That's the first question people ask. What day in September is it? They haven't set a date yet. There will be details to come on the regional and the main conferences. But here is where we come in. When I say we, I'm talking about all the groups that are involved in aging, nutrition, NANASP, MOA, everyone else that's involved, NCOA, and US Aging and other groups. We want to make sure that the unique nutritional needs of older adults are given proper emphasis at this conference. I want to stress that point. This is not a homogeneous population, older adults. They have different needs, different requirements. Some need medically tailored meals. Sometimes you need culturally appropriate meals. You need to be examining what is missing. And this conference is being held at an ideal time as the work on the next dietary guidelines get underway. And the next set of dietary guidelines by law have to include a focus on nutritional guidance for older adults. So what I'm going to say today, and I know we'll do some follow-up on this, is got to be thinking about how Central Llano might want to be involved in this conference, and we will try to find as much information as we can. And I look forward to helping with this conference, and it's very important that we get there. Next slide. So we talked about this new Administration for Community Living opportunity to comment on Older Americans Act programs. So they've released what's called a request for information on the regulations or detailed rules that outline how to implement the 2020 reauthorization of the Older Americans Act. Now, this is a pretty dicey space, okay? Because what you find, and I've spent a lot of my life working in public policy, and there's a huge difference between when a law is passed and when it's implemented, okay? Laws are written in general terms, okay? There's not a lot of specificity in how the laws are written sometimes. So then it becomes the responsibility of a federal agency to implement, to try to understand the intent of Congress. What was their intent when they wrote that sentence? Okay. Well, in the case of the Older Americans Act, they have pretty much skipped that process for a long time. You know, we notice that most of the regulations haven't changed since 1988. And so what they're seeking in this request for information is practical matters regarding the regulations. Okay. In other words, what that really means is, how do you make it simple? Okay. How do you make it so that, you know, it's clear for a provider how to deal with this particular provision of the Older Americans Act? What are the challenges that are faced by those receiving services under the Act? And what are the challenges that are faced by states, area agencies, and service providers in delivering services under the Act? And last but certainly not least, and one that probably will dominate this discussion, is how Older Americans Act programs can advance equity. And I remember a webinar that we did, our NANASP organization did, with some colleagues from the Benjamin Rose Institute on Aging in Cleveland, well over a year ago, beginning the discussion about equity within the framework of Older Americans Act programs. And one of the themes that came out of that, I remember very well, was the fact that we need to put a new emphasis on outreach. Okay, who reaches the people that need the services the most? Are we able to find those individuals? Are the right people communicating with the different audiences we need to reach in serving under the Older Americans Act? Many of you know the law says that services are to be targeted to the elderly in the greatest economic or social need, with particular attention to low income, to rural, limited English speaking, and so on. And targeting was a good thing, but it's pretty old. And the question is, what do we do as a program to achieve equity and get more people into the program? So this will be a key part of this RFI, and I hope that everybody at least touches on that if they do decide to file a comment. And for those who are interested in this particular topic, there will be a webinar tomorrow at 1 p.m. And the link to that is there. And I'm sure we can put that back up later during the Q&A period. So we'll go to the next slide. Talk about malnutrition, a continuing problem, but one that is only in recent times been getting more attention. It is a growing problem involving older adults. Up to 1 out of 2 older adults is either at risk of or becoming or is malnourished. The $51 billion in disease-associated costs is a conservative figure. Malnutrition allows you to be in a hospital longer than you need to be. And, you know, and oftentimes readmission happens at a higher rate as a result of malnutrition. And it happens in the highest numbers of people at the oldest age, 85 and over. So there has been an important new development in the space, and the next slide will tell you that there is now another opportunity for comment. And this has to do with a rule that the Centers for Medicare and Medicaid Services put out that includes for the first time, it's called the hospital inpatient rule. For the first time, it includes a global malnutrition composite score, a quality measure in this proposed rule to allow hospitals and their patients to benefit from identifying and addressing malnutrition. And what that really comes down to, if you walk it through all the different steps that are involved, the last piece has to do with let's say you're diagnosed with malnutrition, there's a assessment done, and then a care plan needs to be done to avoid you coming back to the hospital because of that condition. That will open up a whole new avenue of relationships between hospitals and community-based nutrition entities, okay? Which will be a fascinating thing to see happen. Because right now, there are a lot of hospitals in this country who have no idea that local community-based nutrition entities even exist. Yet they may become pivotal for them to achieve decent scores when CMS comes back and says, did you adhere to this particular quality measure? How'd you do it? So if this goes from the proposed rule to the final rule, it could be a game changer in a number of areas as it relates to nutrition programs and hospitals. So we're encouraging Central Ina to file comments urging that this rule, this proposed rule, be made final. And we have resources on our website, which you'll see at the end on our resource slide, on how you can do a comment very simply, and they're due by June 17th. So next slide, I'll call this thing the lightning round, if you will. A couple of things I want to just make sure we touch on. One is the infrastructure bill, which is now law, okay? If you haven't already started this process, I am encouraging people to follow this money down to who's in charge in this area and how it's going to be used. Because there's a lot of money flowing into communities all across the country. This is a wonderful opportunity to enhance things like age-friendly and livable communities through things like improving their sidewalks and the signage that go into making a community livable and safe for everyone. Yes, the bill is to fund roads and bridges and highways, and that's all important, but also broadband. They're going to need some help in that space. North Carolina, as a state in general, they need to get involved in this because broadband, you know, the digital divide is everywhere in our country. But in your state, with some of the rural areas that you have, excuse me, it's important to weigh in on this, but follow the money down to where it is. Make contact and make sure that you've got input into where that money is going to be spent. The Build Back Better bill. Now that's the second part of what was called the Biden agenda, okay? The House passed their bill back in November. It has very significant provisions in it for aging interest, such as $150 billion for home and community-based services under Medicaid to lower the waiting lists and to improve the status of the workforce, okay? And another $4 billion to build our first ever infrastructure for elder justice, and another $1.2 billion for the Older Americans Act. Well, the House passed their bill in November. The Senate is stuck right now. Senator Manchin of West Virginia opposed the bill. They need all 50 Democrats to vote for it to pass. This has nothing to do with Republicans on this at all. Okay, this is all Democratic bill. And I know your two senators are Republican. However, it is possible they could extract some of these provisions out and put them in another bill. So if you're going to communicate a message to your senators, it is about making sure that whether you support the $150 billion for home and community-based care or the elder justice infrastructure, let them know it's important to you that this get done this year. Okay, don't try to figure out what bill it should be on. Just say we care about this getting done, and you'll be listened to. So finally, in closing, my last slide. As you can see, you know, it's aging issues are pretty active right now up in Washington. Not that they haven't always been, but it's going to continue as the number of older Americans grow. But you know, when you cut down to the basics, you know, the essence of what succeeds for older adults is the work that you do and all area agencies do in this nation. And tomorrow, when I testify about healthy aging, one of the fundamental keys to maintaining one's independence is what you do through your programs and your services and your caring nature. You know, we should not overlook the fact that, you know, you are oftentimes vital to an older adult day to day. You know, I tell people in the nutrition space, a lot of times, you know, the only people who run congregate nutrition programs, they see seniors every day. And when they reopen, it's going to be a wonderful thing to see happen again. So you really, truly do help older adults achieve the theme of Older Americans Month by helping them age their way. So thank you very much. I will let the last slide sit up there for a bit and has the resources in it. And I look forward to hearing Heather. Thanks very much.
Heather, you're on mute.
Dang it. You would think I would get it right after all this time, but Bob, thanks for that excellent and informative presentation. It's just always enjoyable to listen to all the updates that you have, but you're doing such good work in Washington, and we really appreciate it here in North Carolina, knowing that there are just savvy, smart, strategic folks in DC working on these issues is incredibly important. North Carolina really has benefited from federal dollars dedicated to aging services, and really because at a state level we haven't kept pace so long. Typically in the past few decades, the increases that we've seen in North Carolina have been really because of the increase of the federal dollars and our quickly growing population. So that funding formula that gives Older Americans Act dollars to the states really benefits North Carolina, and that's where we've seen our growth in the past. So it's such important work to do that federal advocacy. So thank you again. Why don't we go to the next slide? And before I get started, what I want to do is kind of tell you in North Carolina where we are in the budget process and what our budget process looks like, because we're kind of in the middle of it right now. And it's a little bit different from state to state and even from the federal. So I'll just take a few minutes to touch base on that for everybody in North Carolina. But really in North Carolina, we have a 2-year budget cycle, the biennium. And what we do in our state fiscal year runs from July 1st to June 30th. And we, in the odd years, develop in the long session a 2-year budget. And that 2-year budget gets tweaked in the short session. So ideally, we have a budget that runs from July 1 to June 30th. And in that long session, we have meetings that typically run from January to June. So that's the long part. And then when we go and tweak that budget, those short sessions like now are going to be from May to June. And the goal is really to have everything in place by July 1. And our state budget allocates those state fundings from our general fund, as well as certain other pots of federal dollars. So social services block grant, community development block grants, which are important really on that community level. So we are in the middle of this budget session, and in North Carolina, our House and Senate are Republican led and our Democratic governor. And so what's been interesting is since 2017, we really hadn't had an official budget approved and signed off until this last session. Governor Cooper vetoed that in 2019 budget, and the legislature didn't have enough votes to override. So kind of like what Bob was saying, continuing resolutions have been really the preferred method up until this last year, or we do mini budgets where we couple some couple programs and allocations and move those certain things forward that want to get done. Next slide. But in this last long session, which ended on November 16th, which was one of the most very long sessions we've had in history, that session was about 5 months late. So if you can think about having on July 1 a budget and we didn't have one until November, things were really out of whack. But the good news was it was signed off by the House, the Senate, and the governor. There was a really strong commitment from both parties, largely because of the pandemic and the federal American Rescue dollars that were placed into that budget, that they wanted to have something signed off. And so they worked hard and moved things forward. And ultimately, even though that budget didn't have Medicaid expansion, which is one of the governor's highest priority, ultimately he felt that there were more good things in it than bad things and signed off the budget. We had included in that a lot of those American Rescue dollars. So you can see there the numbers for the biennium, $25.7 billion for this year, and then $26.7 billion for next year, fiscal year. Now, because the budget got started late, many of those dollars there in that first year didn't get to start being spent and hadn't been allocated. And so there is going to be a significant amount of tweaking that will need to be done in this short session. So I think that's something really to remember. Next slide. So the good news, and I think around the board, was it was a big win for aging budgets in that long session. There's not been a year that I remember that we've gotten so many things that impacted older adults in North Carolina. Representative Donna White from Johnson County at the end of the session said, we put aging on the map. She was so excited. She is a RN by trade and an aging advocate, and worked many years as a home health nurse and then within the Division of Aging and Adult Services. And she really led a strong effort to include many of the items that were in the 2019 budget that got vetoed, and included them in this budget. And so I'll just touch on some of those wins that we had, because I feel like they were pretty significant, and not all of them have been implemented to this point. But we saw significant recurring investments in the Home and Community Care Block Grant. And that Home and Community Care Block Grant includes the Federal Older Americans Act dollars. It includes state funds, as well as the 10% local match. And so where we have not kept pace with that funding stream for so long, from time to time there was one-time year funding in there, but then it would drop out. And I think, Bob said it really eloquently about this cliff. We saw a significant amount of money come to North Carolina, a tsunami amount of money because of COVID-19, but because we hadn't kept pace, we're just now being able to provide services to folks. And so when that federal dollar leave, we know in North Carolina, we will have that cliff as well. And so for the first year of that biennium, there was a net appropriations of $3.6 million recurring dollars, and then an additional $2.16 million recurring net appropriation for the next year. So this expansion, although not near enough, is a nice start and will serve approximately 1,500 individuals. Just really great to see. Also around adult day services, a critical program to support people as they age in the community, older adults that need supervision. They may have loved ones who need respite or are working. And so the reimbursement for adult day services, which is funded through the Home and Community Care Block Grant, as well as the State Adult Daycare Fund, had maximum reimbursement rates on them. So unlike other services, providers are not able to establish their reimbursement rates, and so they're maxed, and they had not increased since 2006. We know over the last, particularly 10 years, we've seen a great reduction in the number of adult day services that are able to operate in the state with that limited reimbursement. We saw agencies who would no longer take these funding streams, and the availability across the state shrunk. And so we were able, in that budget, through the advocacy of a lot of the work of the Adult Day Care Services Association and other advocates, that cap reimbursement was eliminated. And so now that rates of reimbursement are being able to be established at the local level, and can consider other local variables like transportation costs, food costs, and hopefully what we'll see is more people being able to be served through adult day services programs, which are so critical. We saw a development of the Home and Community-Based Services Fund, and this is really a structure, a federal structure from the American Rescue Plans, which gave states the ability to have increased federal participation around home and community-based services, and an ability to expand home and community-based services and provide some flexibility even around direct care workforce. And so in North Carolina, they developed a non-recurring fund or non-reverting fund, which means that money at the end of the year, if it's not spent, goes back to the general fund, that this non-reverting fund would be dedicated for home and community-based services. And when I say that, it is Medicaid home and community-based services, and not the Home and Community Care Block Grant. So sometimes we get a little mixed up in that language, but this is particularly around Medicaid. And so it protects that enhanced enhanced match that we get in North Carolina, and it gives us some flexibility, and it gives Medicaid flexibility to do that with, and provides increased Medicaid waiver slots. So we saw increases in the community alternatives program. We are seeing increases in the innovations waiver, the state county special assistance program, which is typically residents who are in long-term care settings and adult care homes. There is a companion program in-home, and so that caseload cap has been removed, and so that makes the in-home part of the state county special assistance program comparable to facility-based special assistance, which really eliminates the institutional bias. It also allows for cost of living, so folks aren't dropped off that program if there's a federal cost of living increase. So these are really exciting things for older adults, and not just those who are in the community, but you saw a wide range of things that would support community living. And I think that's just in reflection of the pandemic and the ability to want to support people in the community, and using some of these state dollars and federal dollars to make that a vehicle. The other big win on this slide, and then I'll move on, is the personal needs allowance, which for folks who are in adult care homes, we were able to see an expansion of the money that they're keeping in their pocket every month. And it went up from $46 a month to $70 a month, and that went into effect in January. So that was a big win for those residents living in adult care homes. Next slide. It's no news to folks that recruitment and retention of direct care workforce has been an issue for a long time in this state. And we've seen it across populations, whether it's people with intellectual and developmental disabilities, children with mental health issues or chronic health problems, as well as older adults. And we have seen it in a variety of settings too. So we all experienced it through home care and nursing homes and adult care homes and private ICF MR centers. This has just been one of those widespread and tragic situations, as we know people have needed care. And so the General Assembly dedicated a one-time bonus for direct care workers across all settings and all populations of $2,000. And it was a great recognition. Many other states use these kinds of federal dollars to support direct care workers, and in some states they help pay for education and training. We saw it in terms of a one-time bonus, which Medicaid worked very quickly to try to implement and get those dollars out as quickly as possible. And I think they have never done this kind of implementation of a program where you had to identify those direct care workers who qualified and submitted that information. And then so there were quite a few systematic changes and problems from Medicaid and NC Tracks getting all that worked out. And some of that had to do with the short time frame because of the extended length before the budget. And so because the way the bill was written, they needed to get those out very quickly. We also saw increases in Medicaid reimbursement rates to assist direct care workers in getting up to $15 an hour. These were particularly in home and community-based settings because of that federal FMAP dollars. And so you didn't see that across the board, which I'll allude to later, but it was a really welcomed increase. And because we now, and Bob talked about, when is the pandemic going to end in terms of the public funding and the public health event, we've seen some of those temporary increases, but to see permanent rate increases was welcomed and super exciting. Also Medicaid reimbursement for private duty nursing, this theme of workforce issues was widespread last session. You're also going to see it in the short session too. Transportation and other one-time investments in the American Rescue Plan. And because Bob talked about nutrition and senior nutrition, we were really excited about some of the one-time non-recurring money that was granted for senior nutrition and the ability to try new things with that and reach new folks. We also saw non-recurring money for North Carolina Senior Games, and 10 million non-recurring for local governments for accessible parks. So Bob talked about age-friendly and planning for a community. Some of the lens of that was how can we better off North Carolina with some of these one-time dollars. So really nice to see that strong commitment there across the board. The not so good news, North Carolina is one of 12 states that hasn't expanded Medicaid, or at least not fully. And so that's been on the wish list of really a lot of advocacy groups for a long, long time. And while we didn't see that full expansion, there was a dramatic shift in the conversation about Medicaid expansion, where you saw Republicans easing their jargon, opening up to the possibility, and did approve the expansion limited to eligible pregnant women in a postpartum piece, where they expanded that small focus of women who were pregnant, had children, and then would be able to keep their Medicaid for up to 12 months after postpartum. And so that was exciting to see, just that small little door open. And we also, there was a commitment to establish a joint legislative oversight committee to examine Medicaid expansion and access, and to continue that dialogue. Bob, you did speak on the elder justice bill, and there was no investment here on adult protective service. Another thing that we've been working on a long time in North Carolina. Adult protective services is a state mandated service, except almost no state dollars go into that. We look to this federal social services block grant to fund that, but really it is the counties that are footing the bill for that. And we know adult protective services is growing considerably, and the cases are more complicated, and counties are feeling the burden. And so the passage of elder justice and the funding that comes down really is important to North Carolina, and advocates really do want to see additional state support for that. The other thing we didn't get movement on, and I will continue to be on the table, is voting rights for residents in long-term care settings. For some of you who may not know, North Carolina is one of 2 states that prohibits any staff to assist residents in long-term care with voting, whether that's requesting an absentee ballot, putting a stamp on it, driving them to the polls. And we are actually the only state where it's a felony charge to have staff help. And so this, during the pandemic, especially when folks were isolated, people weren't coming into the facilities, and our MAT teams didn't have the volunteers that they needed. We had a lot of older adults and people with disabilities living within group care contexts that were not able to exercise their constitutional right to vote. And so we'd like to see that change. So anyway, there were some mostly good things, but still things to work on in summary. And so to the next slide, thank you. This short session is coming up. And so this is our time to tweak the budget. And the session will start next week on Wednesday, May 18th. And it is likely all the other committees to follow will come the next week. But I think the thing that's really going to be important is that our primary election, which is on Tuesday, May 17th. So we've got the primary election on Tuesday. The session starts on Wednesday. It's going to be really interesting to see what kind of impact that has. And that's more on my other slide, so I won't get too much into it. But what we think is that we know that we're really going to probably be looking at bills that made crossover before the long session. So that means they were introduced, they passed one house, made it to the next. And if they didn't make it through the second house, then they're still on the table. There are some exceptions for that under the adjournment resolution to determine those eligibilities. We are now past that deadline for bill drafting. So the bill drafting for any eligible bill that wasn't crossover was May 9th. And then any of those new bills that were eligible must be introduced by May 26th. So particularly just as a point of interest, there was House Bill 699, which increases punishments for elder abuse and neglect. which is one to watch, and hopefully we'll make it across the finish line. And then House Bill 666, which is an advanced care planning bill, which eases the requirement to have a notary and 2 signatures, which was currently the situation in North Carolina for any kind of advanced directives. And so the goal of House Bill 666 is really to ease those requirements and make it easier for folks to have those advanced care planning documents without all the requirements for signature and notary. Next slide. So expectations in this short session. I think if we were to predict anything, that we are going to predict that it's going to be short. You know, the redistricting maps were redrawn last year. They were finally approved by the state Supreme Court. And as Bob said, it's an election year. And so with the primary being on the 17th, we know legislators want to get back to their district and campaign. And there are some limits on fundraising while they're in session. And so I expect that's going to be a motivator for folks. And there also has been some chatter over the long session that we need to set session limits or move towards a full-time legislator and change the way in which we do that if we're going to continuously not meet our deadlines for getting bills in. And so I think people are really cognizant about length of time. And what we'll do is we're going to see a short session. What we're hearing is that probably that first week in July is when they'll wrap things up, which would probably be around the 4th of July. But again, there's no crystal ball there, but I think folks we will be fast and furious for the next few months. Topics that will come up during the time that we were not in session, and really since the beginning of the year, there have been interim committees and several joint legislative oversight committees, which were made up of House and Senate members, and they've been meeting actively. And so, for example, the Joint Legislative Oversight Committee of Health and Human Services had several meetings, many focused on opioid use, behavioral health, children's foster care, and then nursing home staffing in particularly. Joint Legislative Oversight Committee of Medicaid has talked a lot about the Medicaid overruns that they've experienced, largely in fact because of the projections that they made didn't account for the Medicaid rates continuing to stay as high as they have, and they had thought that they would go down and that we would be out of the pandemic. And so we know we have major Medicaid over expenditures that need to be corrected. And then the Medicaid expansion group that I talked about, the Joint Legislative Oversight Committee, has met 6 times since the beginning of the year, and they've brought in states from Ohio, Montana, Michigan to tell us about their experience in Medicaid expansion, which has been really helpful for legislators to understand kind of the nuances and the options available to North Carolina. We also focused on advanced practice nursing and the SAVE Act, large focus on rural health, telehealth, nursing shortages. So those joint legislative oversight committees really gave us insight into what we think will be part of the discussion. And so, you know, Medicaid expansion will still be on the table. There's some debate whether it will happen in the short session or there may be a special session after the short session to focus specifically on Medicaid expansion. But I think you'll see lots of activity on telehealth, nursing, in the SAVE Act, direct care workforce, and behavioral health. So really important things here in North Carolina, and a lot of it has to do with just sort of the impacts of the pandemic and things that were not really working well before the pandemic. So I think that's going to be exciting and will create a whirlwind of activities. The other question is if we'll even have a signed budget. So they pulled it off for the long session, but there could be some hangups with the signing of a budget. Again, it's not out of the woods. And with the elections and some changes, we know that there are folks who are moving to the Congress or at least running for Congress, who will be lame ducks. We've got some double bunked areas because of the congressional redistrict. So we're going to have people who may be changing their motivation about how and why they vote. We do have some veto overrides that might come up as well. In the last session, there were bills that were vetoed around critical race theory and abortion, which may come back up. Today, I just learned this morning, though, that the governor's budget will be released at 11 o'clock today. And so that will really give us the forefront of what we'll be seeing, at least in terms of his recommendations. Now, whether the House and Senate agree with that or throw it away, I think it'll probably be somewhere in the middle. Hopefully they can find some common ground. So let's go to the next slide there and just think about issues impacting the session. So the revenue forecast came out on Monday, and they were really good, with $4.2 billion more in the current fiscal year than expected, and $1.9 billion more than in next fiscal year. So North Carolina's got some money in the bank, and how they choose to spend that, it will be really interesting. So it's good news that we have the positive forecast. We know that federal aid sped up job recoveries, which drove up the sales and the income tax collections. And so we've got this good economy, but whether or not there's commitment into spending that will be interesting. And we do know that Medicaid and the overruns there will eat up some of those dollars too, because they've got to rebase Medicaid and come up with some long-term solutions as well, particularly around nursing home reimbursement rates and in other areas that are still feeling the brunt of COVID. So child care centers, other congregate settings, I think we're starting to see things really loosen up and folks going back to work. And certainly schools have been in place for a long time, but there are parts and segments of the publicly funded sector that are still heavily impacted by COVID. So the public health emergency is going to be really important in being able to leverage those dollars. The education budget's going to impact what we do and what kind of spending there is. Some folks really have kept up with the Leandro case, and this is a 20-year case in North Carolina that states that there is a mandate to provide every child with a sound and basic education. And the state Supreme Court just recently had a court order of $1.75 billion to transfer into education. And so there's been lots of back and forth around the General Assembly, if that's really the role of the state Supreme Court to require funding, and that story's not over. But that education budget really plays an impact in what money's available in the budget to be spent on aging services and other services, as well as wage increases for teachers and state employees. That job loss and attracting workers certainly impacts schools and state employees. And so there's already been some conversations about what those raises could look like. And because we have such a large state employee and teacher population, those are big expenses and always take a chunk and are part of the negotiations. So the other, piece of it is these primary election results. And so several members are leaving to run for office. Redistricting is in full swing, and I think is really how folks are going to decide to vote if they're not running for re-election, if they're running for other offices, is going to be important. And are we going to have the votes for any kind of veto override? Certainly things to watch for. And then finally, on the last slide, in the meantime, between now and when the session starts, which is really just next week, what can we do? Part of it is, and what I think is the most important part, is for you to connect with your legislators. Many of you are working in organizations that are providing these critical services to older adults in the community, and these valuable services are so important for legislators to know how these public dollars are being used and the quality services. And so I would suggest to you to invite your legislators to your Older Americans Month celebrations, right? Get them to tour your facilities and go on home visits. It really changes their perspective when they know what's in their community. And it's an election year. So particularly legislators want to be in their district, especially if they're running for office or re-election. So let them see the power of the well-run programs that you do. It will be important for them. It's motivating. They want to be seen. And I think for you to be able to have that strong connection, if you don't already, is worthwhile. And at a minimum, just make sure they're on your newsletters and getting your emails. But I would encourage you to reach out, to make appointments, to tell them the barriers in their communities. At the state level, we can hold meetings with legislators, but unless it comes from the district and it comes from their community, there's only so much lobbyists can do or other advocates at the state level. And so pairing up and making those connections are critically important. And I think the Older American Act is really unique in terms of the opportunity and the expectation that providers do advocacy. So take full advantage of it. If, for instance, you're not as comfortable with the advocacy, think about it in terms of the lens of education, that's an opportunity for you to talk to them about what you do, get to know service promotion if that feels a little more comfortable, or engage your service recipients or senior center participants into that work. Let them know what this means for them, because we have a lot more work to do. And I know we've got some money coming into North Carolina from federal COVID relief that's expanding our services, but let them know what's going on, how you're using that money, the innovation that the network has, and the concerns about the cliff. And we need to be keeping up with this. North Carolina is one of the highest older adult populations in the nation, and we need to keep pace with what we're doing. The North Carolina Coalition on Aging and our partners will be holding an Aging Advocacy Day at the legislature. It's a virtual event on June 24th. So I invite you to come to that and participate. We can send out the link with the follow-up materials. It's going to be a whirlwind session, and part of it's a waiting game right now. We know that the governor's budget will be released today. I think that will give us a first view, and then we'll have the House and Senate go through their budgets. We're going to continue to watch to see what happens with the primary elections. The session will get started, and also then committees will be started on the calendar. So we do have an Aging and Family Policy Committee, Health and Human Services committees, and all of those will have important things that advocates will want to pay attention to. They can be streamed through the North Carolina General Assembly's website, and you can listen to them too. But I would recommend, particularly if you watch the committees and get insight to the topics that are being presented, you really get to see where legislators fall, what kind of questions they ask, and what's important to them. So with that, I will kind of zip my lips, and Bob, I will be available for questions.
All righty. Well, let's do that then first. I have a couple of questions for actually each of you. Heather, this is from Amanda. Amanda Buck is with us today, and she says, there have been multiple raises in the Social Security payments over the years, but there's not been an increase in Medicaid income eligibility requirements for special assistance funds, for assisted living, and for memory care in adult care homes. Do you see any, do you ever see the $1,200 for adult care home and $1,500 income cap limit for memory care increasing?
So, Amanda, that's a great question. And part of the reason we haven't seen that is Republicans have seen those increases as a form of Medicaid expansion, right? So if those if those eligibility numbers go higher, you have more people eligible, and that's viewed as expansion. What we did see with the SA program is that those eligibility rates will be tied to Social Security cost of living increases this year and from now on. And so that's really exciting that at least it's tied to cost of living. I still don't think it's quite high enough. And what you would hear from adult care homes is that reimbursement rates are really low too. And so they're providing care to a more complex group of people with a reimbursement rate that's very low. And you see, not many adult care homes, or at least it's shrinking the number who are accepting special assistance as a payment. And so, that turns into limit of access of services, or trying to, place your loved one and having to drive further because you don't have any local adult care homes that are taking SA patients. So I think that's in turn, if I were to say it, something else that was important was the expansion of the SA in-home program and the reduction of that cap. So it gives families an alternative to placing loved ones in an adult care home that accepts special assistance. You can use more widely the special assistance in-home program. Of course, it doesn't provide 24-hour care and doesn't provide the same benefits, but it is another option and opportunity. I think folks will continue to want to support any increases in that eligibility rate, whether or not it happens or not. I can't guarantee, but I know that just Republicans in general are try to curb spending as much as they can, and that's one of the surefire ways they hunker down.
Thanks, Heather. Bob, believe it or not, Katie Howard's here from Georgia. I don't know if she stayed on to listen to the North Carolina part. So, but Katie did want to mention, and we're sort of in a similar boat, that Georgia still didn't have their ARPA funding yet, but they were encouraged because their General Assembly was going to cover the match in Georgia. And
that's good to hear.
It is, huh? Many of you don't know that a lot of the ARPA money that filtered through the Older Americans Act, unlike any of the CARES and other relief money, which had no match, this had a match for the local community, and it's thrown some programs, I think, for a loop. But Katie also wanted to know, she was just curious as to why you thought the president drastically reduced his recommendations for the NSIP funding in 22.
I wish I had a good answer for that one, Katie, because the only thing there wasn't much in terms of the explanatory document that went along with the budget proposal that came out on that. My gut tells me that it has something to do with the slowness in reporting NSIP data back to Washington. I shudder to think about how complicated it is for you folks at the AAA level and other providers to sort out your pandemic money, your FY21 money, your FY22 money, et cetera, and then have it all kind of lock up nicely. But NSIP is a supplement, if you will, a per meal reimbursement for meals that are provided. And so the only thing I can think of is that it may just have been a slowness in reporting the data, but we're tracking that and we're looking to see if we can get that number up in the final House bill and the House and Senate bill.
Okay, thank you. And then Heather, I'm going to go back to you. You had mentioned, and most of the providers and AAAs and subcontractors that we deal with realize that for the first time in a long time, there was an increase by the state for home and community care block grant funds, or HCCBG, for some of you that have heard that term or acronym. So, and it is for 2 years, current year and next year. Is that going to be automatically recurrent, or will that have to be something that advocacy groups will have to will drop out of the budget each time?
No, so it's recurring. And so just to kind of explain, the first year we saw the bump of, I think it's 3.6 million. And so that would recur from then on. But the nice thing was then there was on top of that, another 2 million recurring. So what we'll see going forward is over $5 million recurring from then on. And so that's permanently in the budget. And advocates will want to advocate for additional recurring money on top of that, but at least we're going to see that continue on until there's a change. So I think most of us are just familiar with that one-time money that we've gotten. And so, I mean, I remember years where we were hung up on just like $1 million we were going to lose because it was in there for 2 years. And then that $1 million was going to be gone. This is not that $1 million. So this is nice that it'll continue.
Thanks, Heather. Katie, if a lot of people are interested in the link Bob put up for the Older Americans Act, what is it, webinar, informational webinar, Bob, tomorrow for comments?
Right.
Could we put that back up so some people can copy or put it in the chat?
Absolutely.
Yeah, very interested in that, Bob. And that being said, any crystal ball on some potential Older Americans Act changes?
Well, you know, again, you got to separate out the ones that can be done legislatively and the ones that can be done through regulatory activities. My guess is that they're going to be looking at where the innovation activity has been. They put a lot of money into grants for innovation in the nutrition space, as you know. And, you know, it may be that they will use both that and some of the aftermath of the pandemic. You know, what things may have to be written into the rules on how services are provided. And but it's going to depend on comments too. I mean, people, you know, if people respond to a request for information, there is value in that. Okay, because it can demonstrate a level of interest. It could promote new ideas. Okay, it could maybe stop something bad from happening, you know, which can happen on occasion. So I think the way to do a RFI response is to suggest something that's working in your area that isn't currently in the regs or isn't provided some guidance, and just say this should be. You know, it would make it much easier to codify this and put it into the regulation so we can all continue to do this thing because we know it works. So again, that's why it's important that people respond to it. And there it is. Okay. Oh, there it goes. It's coming back. I know. In any event, that's what I think they will take what comes back and look at it seriously. But let's hope people respond, because it's been so long since really you had a chance to look at and comment on the regs that I hope people don't take it and get complacent about it. This is an opportunity you should take.
Yeah, that's a great suggestion, Bob. And Katie typed it in the chat. You copy it from there, or it is also, or click on it in Bob's slide. So I think that we should take advantage of this. It's a really great opportunity. So, well, Bob, while I have you, I'm so sorry. I scrolled right back over it, and there was one other question in the chat. When there is more funding for senior centers and nutrition allocation, is there a way to provide equitable socialization and nutrition services within senior centers for those living within the constraint of a dementia diagnosis? This programming is vital for those with dementia, and especially for their caregivers, who often are spouses with no social outlet. Will the outreach you are proposing, because I think you had mentioned about increasing our outreach, and it is an important tool, Heather mentioned it too, have a focus on this?
Good question, and it should. There's no question that it should, and there is, I think, as time has evolved in the Older Americans Act, there has been more sensitivity given to individuals with dementia and their caregivers in terms of services being available and provided. I think what has to get done, though, is in the context of doing the outreach, there needs to be a closer linkage, if you will, to what's the most appropriate service for the individual, okay, and or their caregiver. You know, socialization opportunities are important throughout the whole structure of Older Americans Act programs. They make a huge difference in how people function from day to day. But there are unique challenges associated with those with dementia and and Alzheimer's that have to be factored in, that I know the service providers are aware of, but it may require some updating of guidance from you will, if you will, from ACL to states and area agencies. And perhaps that can be proposed as part of the RFI that we just talked about. So maybe that individual could put that on in his or her request in responding to the RFI.
Yeah, that's a really good point. Heather, I know that you've been doing a lot of work with direct care workers and a living wage. Could you just give us a little 1 or 2 minute on how you're doing that and what you're trying to work in for advocacy and working on that? I know we've all seen from every program we run right into skilled nursing facilities and assisted livings, but also, other programs in home aid that we do through the block grant, just a severe shortage of aides this year.
Absolutely. So we have primarily been working to bring together kind of collective voice around direct care workers. And so what's different about this is that it's being seen across all funding streams and payer sources. And so it was so dire that typically the advocates are really siloed on that, right? You've got IDD providers, you've got home care providers, you've got nursing home providers, children. And so we really have worked hard to cultivate partnerships with all of these groups because we realize that this is a very fluid workforce, that if the competition with private industry is so strong right now with wages that people are moving from job to job, and we need to be working together. Being isolated is no longer effective. And so before the long session, we really provided that joint collaboration, which was exciting and focused around wage increases. And we had really wanted to see a wage pass through, so there would be a mandate for that permanent Medicaid reimbursement rate to be passed through wages. And what we saw, there was the intent of the governor and the General Assembly to increase wages and get a little closer to $15 an hour, but it was not a requirement to do that wage pass through. So providers have the ability to use those dollars on other things. So we're really tracking and want to be able to watch how those additional reimbursement rates are going to workers, if it's making a difference. The thought is, or was, that the competitive nature of direct care workforce is so strong that industry would have to pay folks, and the requirement wasn't needed. So I think we're watching that front to see, and the promise was it was a first step, and so we're going to hopefully see this afternoon maybe a second step from the governor, and hopefully a further commitment. Now, between the end of the long session and the beginning of the short session, there have been terrible situations in nursing homes around shortage of staffing that have gotten a lot of coverage in the news, and was the focus of one of the Health and Human Services Joint Legislative Oversight Committee in Thomasville was the particular situation. And so that, coupled with the nursing home lack of reimbursement because of the home and community-based services funding that was used, is going to get some attention. And so I feel like you're going to see that focused on during the short session, but we also need to focus on things that don't cost money, right? There's a lot that we can do in terms of increasing the pipeline and looking at other workers, creating portable and universal training and curriculum so that we can realign and really bring people in, the public awareness about these jobs and the complexity and importance of direct care workers. So with our initiative, we are focused and have a roadmap for advocacy that includes wages, but we also have a real need to start doing other work because this problem is not going to be solved just by wages as well. And we need to continue to move that front because we're at the beginning. I think it's only going to get worse from here. And when we think about the aging of our populations and the needs in the future, and the pandemic in these long-term care settings, whether even at home, they're not going away, and people are leaving in droves these jobs, and it's impacting them across the board. So yeah, if folks are interested in getting on board and or sharing their stories, I'd love to hear them.
And just I think everybody has Heather's email, or Katie can put it in, or their website is what, NCCOA.
onaging.org. Yeah.
Okay.
Thanks.
All right. And then lastly, for Bob, and then any last call for anybody else who wants to put a question in the Q&A or the chat. But I have one more for Bob. Bob, we're really, really excited about the White House conference, and it's going to encompass a lot of issues. And you did touch on this in your slide, but how can we really make sure, because I've been to other events and coalitions on hunger, and I find that the older adult issues really are a challenge to get in people's minds, that the children and family issues, come up first and take the forefront. What can we do, and how can we make sure that doesn't happen, or at least that we get some equal time and footing?
Yeah, and that's a great question, and it's one that we, are dealing with on a daily basis here in making initial contact with the folks that are been given the initial responsibility to start putting this thing together. I know from having talked to several of them in the last week that their overriding concern right now is getting this thing pulled off. Okay, not so much, they're not worried about being insufficient number of topics. There'll be plenty of topics. They're concerned about, okay, the president said we got to do this in September. It's now May. How are we going to do this and get everybody accommodated? So I think how this is going to work is there will be some communications that will come at the national level from nutrition groups urging that very point that you said. I think every regional and or local forum that's done, that needs to be put on the agenda so that it's reported back to the people running the conference. I've suggested to them that they maybe use a model that we did back in 1995, where you sanction events, making them official White House conference events, and then that has a higher level of standing. And if you come out with a recommendation that specifically says, the concerns of older adults need to be factored in the following ways, then it can hopefully make its way into the actual agenda of the conference. But in the absence of knowing exactly how they're going to do it, it's hard to answer that question right now. But I guarantee you, and you know this, Linda, because it's something that's on all our minds. And what you just talked about is very true. There has been trouble getting through the door. I'll give you one other point that I think is important, because I had a conversation last night with somebody about this. Our friends at the Academy of Nutrition and Dietetics, who represent the registered dietitians and nutritionists, they're interested in our case too. They're interested in our cause too. And they're going to have a lot to say about this conference. And so we will work closely with them in addition to our normal groups to make sure that message is delivered.
Thanks, Bob.
Mm-hmm.
I think, Katie, I don't see anything. So I think we're pretty much wrapping up, unless, Katie, you have anything, or Heather or Bob, any last comments?
I just would like to say thank you and happy Older Americans Month to everybody. This was fun. I appreciate the opportunity.
No, thank you both.
I second that thought. Thank you very much.
Thank you both. And Katie, thanks for serving as our technician back there today, and we really appreciate it.
Great job, Katie.
Watch for more information on our June webinar. We do have a great program that we're firming up, so please watch for that. You'll probably get an email as well. And thank you all so much for your continued support. And thanks to our speakers, and have a great day. Thank you.
Yeah. Bye, everybody.
Guys.
Bye.